Welcome to the Dose of Optimism, where I talk to the optimists in healthcare. My name is Omkar Kulkarni, and I work at one of the world's best children's hospitals, where I lead innovation. I started KidsX, which is a premier international startup accelerator for pediatric innovation. And over the years, I've met thousands of startups, investors, and innovators. Every one of them has a story, and every one of them is optimistic about the problems they're solving. On this podcast, you'll meet amazing people who will share their stories and what makes them optimistic about the future of healthcare. A little note before you get into this episode. This podcast is for informational purposes only. We are not offering medical advice, and we're not endorsing any products. Please talk to your own physician about your health or the health of your children. All right, let's get started. My first guest today is Dr. Lyndsey Garbi. She's the pediatrician, neonatologist, and the chief medical officer at Blueberry Pediatrics. She's going to talk to us today a little bit about a novel new care model that leverages technology in the home to help reimagine how parents access primary care and urgent care through digital technology. Dr. Lyndsey Garbi, thank you for joining me today.
Thank you for having me.
Tell me about Blueberry Pediatrics.
So flattering to hear that you've heard about us for so long. We are a pediatric telehealth service, so it's all virtual healthcare, which really provides easy and affordable access virtually via call, chat, or video to board-certified pediatricians. So the goal is to reach families where they are at home. We send home a diagnostic kit, which has an otoscope, a pulse oximeter, a thermometer, which really enables us to make more diagnoses from home safely and accurately, keep kids out of the ER and really back to their medical home where they belong. Preventive care, proactive, and really wholesome evidence-based medicine.
So you're in New York, I'm in LA, but so many kids live in suburban or more so rural areas where there's not access to expert pediatric specialists or pediatric urgent care doctors or pediatric ER doctors. How does Blueberry play into that landscape? How can Blueberry Pediatrics help with the problem that we have, which is a lack of pediatric expertise, particularly in rural parts of this country?
So it is a real problem that we have. About half of US kids do not have easy access to healthcare. Obviously, majority is going to be rural America. We have a shortage of pediatricians on the rise. There's an estimate of it to be something like 15 to 20,000 by 2036 with a shortage, which is like 10 years from now, which is really soon. Only about 14% of ERs are equipped to even handle pediatric visits, which leads to higher morbidity, higher mortality. So there really is a problem in our country. So what I think really needs to be done overall, there is a huge overhaul of where our focus lies. First of all, rural areas, which there is a bit of a push, but like the Big Beautiful Bill is going to really hurt us. And then yet there's this Rural Health Transformation Act, which is really trying to pump more money into rural health, but I don't know if it's going to be enough. And then for kids too, like just the focus to be on kids in rural health, it's like a double whammy because with both of those hits, like the preventive care, the proactive care, the outreach really is going to hurt. It already hurts now. What we're looking to do is to meet people in their home via telehealth, which gives them easy access because a lot of them cannot just drive to their local pediatrician. A lot of them can't just drive to a local children's hospital or even like a regular non-children's hospital for the things that they would maybe ignore for a little while. Just those even developmental questions that they're wondering about. They have the ability to see a pediatrician when they need for whatever they need. That's the goal, especially for things we don't want to have escalate. So like that ear infection or whatever it is that doesn't have to develop into something terrible later on. Hopefully most can go away on their own or would need antibiotics, but for those things that could be missed if they're not given the acute attention they need, we'll have that immediately with good follow-up too.
So virtual urgent care is not new, right? It's been around for a while, but what you're doing that's new is you're introducing devices into the equation. So the gap that I think exists with traditional video urgent care is the pediatrician can't necessarily get all the information, the data they need because they don't have the tools that are required. So one of the things you did is you've created this box of devices.
So we have two models. One, which we have used predominantly up to this point, is direct to consumer. So any parent can go onto our website and buy a subscription for Blueberry, which is about $20 a month, which includes all the children in the family for unlimited access to pediatrician. There's no charge on top of that. That includes the kit, which has these tools. And I would say virtual telehealth care, even for kids, like you said, is not new. But I think what we're doing is more specialized and innovative for kids because we're so focused just on them. Usually kids are an afterthought. Like for us, that's all there is about the kids. So we're a very sticky service. We know what kids need specifically. And obviously we're staffed with only pediatricians and people who know kids. So they can use these tools at home very easily with the box that they get. And then so the second model, which is partnerships with either health systems or payers, which means it's really a win-win all around because our goal is to save overall healthcare costs. So if a healthcare system or a payer is taking on risk for these kids, they're probably losing a lot of money for what is spent on kids using the ER unnecessarily or for primary care things that could be handled at home. So if we could get them at home with our kit, with our tools, with our pediatricians before they head to the ER, we're now going to save medical costs, save travel time, and be more proactive with preventive care for kids. So they can also access it if we have these relationships with a payer that is within their area or the payers that act that of the care plan that they're under. They can get it for free through these systems, and then we're saving overall total cost of care for healthcare too.
And you've got some examples around this. Was it in Orange County or Florida? Somewhere where you deployed this solution with a partner and you were able to show cost savings.
So we've partnered with Johns Hopkins and we've been able to show they started with their employee population and that worked so well that they said, let's do this with our ACO. And so we've been able to take on the members, especially the ones who are at higher risk for these repetitive ER visits that are unnecessary and show a cost savings that's quite significant.
So what's next for the company?
It's relationships with payers, with health systems. And then I think rural health, like you mentioned, is just like a real ripe area where it's not about how we're going to expand necessarily or an opportunity for Blueberry, but it's also what's really needed in the field of pediatrics and where we can really make the most difference. I do think that in these value-based care relationships, taking on risk and cost of care is going to be the future of what we're doing because it's such a perfect relationship and gets the kids what they need and for no cost to the families.
Dr. Garbi, thank you for joining me. I appreciate your time and everything you're doing with Blueberry. My second guest is Dr. Sucheta Joshi. She's the medical director of the Comprehensive Epilepsy Program at Children's Hospital Los Angeles. She's a neurologist and focuses specifically on epilepsy care and has been a pioneer in the use of telemedicine and telemonitoring for epilepsy care in children, adolescents, and young adults.
It is a pleasure and an honor to discuss aspects of epilepsy, a topic very near and dear to my heart. So thank you.
Of course. You've talked about this era that we're in and that you've practiced through where pediatric epilepsy went from being a mystery to having now identifiable genetic causes or even gene-based interventions for epilepsy. As you look back, at what point did you realize that genetics had truly changed the trajectory of care for kids and families?
When I went into pediatric neurology and then pediatric epilepsy, even during my training years, we always talked about what are the causes of any neurological disorder, including epilepsy. And one of the things that would come up is, was there something genetic underlying all this if we did not find an obvious structural abnormality on an MRI or something in the history that said this is why a child has seizures? Back then, genetics was really more, it lived on the outskirts of if you don't find anything, let's think about genetic testing. I remember as a fellow in training, a gene for a particular kind of epilepsy was discovered. And up until then, we knew about that epilepsy as a clinical syndrome, if you will. So, a collection of different types of seizures, other signs. But to me, as I look back, I feel like that was like a defining moment where we suddenly had this is the epilepsy, this is the gene. And then over the last several years, we've gone from being able to give the family an answer as to why their child has epilepsy when some causes may or may not be obvious. But even then, families would still say, well, I don't really care about knowing why. It's just that I'm going to know. So what? We now are at an era where we can actually use that information from a genetic test and a genetic diagnosis to really describe a certain type of epilepsy, to think about picking treatments, to really frame it in the context of not just here is a gene that is causing your child's epilepsy, but in a much, much broader context. So I think as I look back, I can see that transformation and transition from here we have an esoteric test that may or may not give us some answers to actually we can use that test in a very clinically relevant manner.
There's also this element around genetics where, let's say, a child has a very specific genetic mutation and a clinician prescribes a certain medication that actually might worsen their seizures. It seems like the additional field now is physicians may be guided on what not to prescribe because a child has a specific mutation, and that could help impact or improve medical decision making broadly in pediatrics.
Absolutely. Once again, to go back to what I was saying just a moment ago, is that there are certain genetic conditions where we understand what that gene actually does. So to give you an example, there is an epilepsy that the mutation that is associated with this epilepsy is in a sodium channel gene. And this epilepsy is what we call Dravet syndrome, that is linked to mutations in the SCN1A gene. And what we know in the vast majority of kids who have SCN1A mutations is that if we give them medicines that impact the sodium channel, it can make their seizures worse. So that's a great example of what we should avoid if we make a certain genetic diagnosis. There is another genetic diagnosis where valproic acid can really make things worse for children with that particular POLG mutation. And so these are just a couple of examples where we can now use the genetic testing to avoid medicines that will not only not help these kids, but will actually make their epilepsy worse.
Gene therapy has become such a big part of pediatric innovation and therapeutic decision making. What is your viewpoint?
I think gene therapy is here. We don't have FDA approved gene therapies for epilepsy yet, but they're at our doorstep. They're coming. And there are some clinical trials which are further along into the sort of the pathway to having these therapies approved. I think all along up until now, we have thought about treating epilepsy as mainly treating the symptoms, which is making seizures better. As we have understood better and better the genetic underpinnings of epilepsy, we're able to think about not just targeting seizures, like treating the symptoms, but actually treating at a cellular, molecular, and biochemical level what is causing these epilepsies. Now, another thing to bear in mind is for some of these, not all, but for some of these, as we understand these genetic mechanisms better, some of the treatments that we had, including the genetically mediated treatments, not only impact seizures, but have the potential to actually be disease modifying. So they can have a much broader impact on these children's lives, development, and not just their seizures. So I think once these therapies are here, they are going to be here to stay. And it's a very exciting time for pediatric epilepsy and pediatric neurology. We have moved from the era of we can diagnose conditions and we don't have definitive treatments to now we're looking at definitive treatments. To borrow from my colleagues in the neuromuscular disorder space, gene therapy and genetically mediated treatments have really changed the face of how these children do in terms of their outcomes. And I think epilepsy is going to follow.
Do you think there's a world where with gene therapy, kids who have seizures because they have epilepsy may in the future as adults not have seizures?
I think it is something to look forward to. We don't know what the future holds because any new therapy is going to come with side effects and downsides to it. But I think these treatments hold a lot of promise.
That's great. So you talk about FDA, so regulatory approvals are one piece that we need. What else is needed to get to this future where both genetic testing is more readily accessible, gene therapy is a tool that can be used in terms of treatment?
The clinical trials are underway. Once these treatments are available, making them accessible to a broader group of our patient population would be really important. As you can imagine, as in the other spaces, these treatments are going to be quite expensive, and just making them accessible and available to all our kids is going to be really important.
They can significantly improve quality of life and even the ability for that child to then independently grow and thrive as an adult. So I could imagine the value of being able to invest in those therapies for children, because I think the ultimate societal benefit would be tremendous for not only the individual, but also the family.
You're speaking to the choir over here. We're definitely on the same page when it comes to that. There's a lot of ways to look at this. By improving not just seizure control, but quality of life, I think the downstream impact on the medical system, utilization of emergency rooms, ICUs, these individuals having a significantly improved quality of life. These are all things that I hope we can measure in the future once we are in that area. But when I just reflect back and think upon where we were in terms of, sure, a family wants to know, a doctor wants to know, to now we can actually use that information to make an impact, to not just treat seizures, but have an impact on the disorder as a whole. It's a very exciting time to be.
Dr. Joshi, thank you for joining me and sharing your hope for the future of both detecting and screening and treating pediatric epilepsy.
Thank you for having me.
All right. Thank you for joining us for your dose of optimism. Make sure to check out our show notes to get more information about our guests and the work they're doing. Visit our podcast page on the KidsX website to join our podcast community and to learn more about pediatric innovation. Thank you to our sponsors and to our presenting partner, KidsX. Please subscribe wherever you get your podcasts, and remember, it takes a village to make sure our kids grow into healthy adults. So volunteer at your local library, help out at the community center, and if you're so inspired, donate to your local children's hospital. All right, see you next time. The content, views, opinions, and information presented on this podcast do not reflect the views of Children's Hospital Los Angeles or of the sponsors of the podcast.